just our expert panel, and we'll have questions for everybody. Okay. That was we're taken from our clinic. These are hot off the press, some of them. Okay. Kayla, do you mind? I'm going to start with you. Is that all right?
Yeah.
You were great to talk about stuff, and maybe you can explain what I might not have explained fully, but can you talk about this somatic expansion? What does that mean, kind of thing for our patients?
Yeah.
Um,
Yeah, I spoke a little bit about it too in my talk, but so people are born with that genetic change, and that is kind of like the blueprint for everything else in our lifetime. And our cells are constantly dividing. Over time, they're replicated in different areas of the body. And because someone with HD already has that longer than typical CAG number, it's unstable. So as it continuously replicates in the body, it eventually expands and expands because it's unstable. And particularly in the brain is where we see this expansion in HD. So somatically just means in a specific area of the body, as opposed to germline, which is something someone's born with and is that blueprint that we test in genetic testing. And so with somatic expansion, once it's the CAG numbers at a certain point, because it's more toxic and causes the symptoms of HD that we see.
okay. That's very well said. I think better than I said. This was actually a pretty new concept, actually, although it's been around for probably a decade or so.
Mhm.
But the fact that we focus on the CAG number, but that it's actually quite more unstable than we thought, and that instability may lead to onset of disease. And if we can slow it down with modifiers, that's huge for us.
Yeah.
Um, so I'm going to turn to Alana. I'm going to let you do this question here. So this is not just one person, but actually a number of our patients who said, our son has HD and it's getting worse, and he's been denied disability already a few times. You showed us some resources, but what are, can you just tell folks kind of how to go about this? I mean, how do you approach this? And how can you get some resources and maybe home assistance? They're at their wits' end.
Okay. So, yeah, disability is really difficult. Most people are all denied the first time. I've heard of people going through this up to 3 times before they are approved, and that leaves people without help during that time. So, first suggestion I would have is that if you're not working with a lawyer, to to go to a lawyer to help out with getting your case approved. But in the meantime, getting home assistance. So I think the strongest way for that to happen is if a family qualifies, or if the person with HD qualifies for disability. There is a certain kind of I'm sorry, let me rethink this. This is a complicated subject. So sometimes people can get Medicaid. Usually they have to be already approved for disability. There are other ways that people may be able to get Medicaid. And through Medicaid, they can apply for a certain waiver that gives extra assistance in the home. That is probably the strongest resource for families if they are able to do that. So other options would be, as Lisa brought up in her talk on apathy and about some programs during the daytime for patients. Um, if they have some cognitive issues, they may qualify to go to an adult kind of care center during the week to give the family a reprieve of
Mm.
caregiving, or if they're having to work as well as being a caregiver. That is usually paid for on a sliding scale. It depends on the county, but that is something where you can contact your local area on aging, and they can help you out with that information. And if you're a patient here at our clinic, I would be glad to help you out with that process. One other resource that can be more difficult, but is also the closest, is family and friends. If you can get them to kind of put together a commitment of patchworking some hours together for those times when the caregiver needs that the most, I think that right there, reaching out to family and friends and saying, this is the time I need your help. Things are getting hard. I can't continue to do this by myself. But I want my loved person to be staying at home where they're comfortable. So, asking for help, reaching out. Do not wait until the last minute when you're feeling at a breaking point. Go ahead and start asking for that now. And I know that is hard. That is hard to do. Yeah. But you
Yeah,
won't know until you try.
yeah, I keep saying this is a tough disease, and I think the issue is it hits people in their prime, and they may lose their work, their job, and their insurance, and it's just the bad timing, and healthcare and long-term care and just getting home care is so expensive these days, and most people don't have a savings for that, so it's extremely stressful. Those are good things. Um, Well, I'm going to ask you, Lisa, I'm going to ask you a quick question here about that everyone asks about. How do I find a rehab specialist in my
Yeah.
area who knows something about HD? Do I need somebody specific?
To answer the last part of that first, yes, you do need someone specific. There are therapists are not created equal, and therapists tend to specialize, much like physicians do. There certainly are generalists, but we tend to navigate more toward orthopedics or a neurology focus. And so you want to find a therapist that certainly has experience dealing with neurological diagnoses. They'll have a better understanding than one who focuses on orthopedic issues. One way to find that person is through the HDSA has a listing of providers and clinics of excellence. The Huntington's Disease Society of America does, and so that would be one place to look. There aren't clinics, of course, in every location, so if that's not an option, the second best place to go is a clinic that is associated with a hospital. Now, it does not mean that they're going to have expertise in Huntington's, but you're far more likely to find therapists that have experience with neurological diagnoses in a hospital-based clinic as opposed to the private clinics. Most private clinics tend to focus on orthopedic diagnoses.
Yeah. I'm going to ask you a related question, or maybe even Lana, you
Mhm.
can help answer this, but we frequently get questions, is there a place that takes care of HD patients, a long-term care facility that knows how to do this in Florida?
Yeah,
Um,
Alana, that's a better question for Alana.
yeah.
Yeah. Yeah. So there are not specialized places for patients in Florida for HD as far as I know at this time. Resources are constantly changing. Um, However, there are some facilities that do accept HD patients in Florida, and we are willing to go and help the staff there understand about behaviors and different specialties of HD that they need to know about so that they can work with the people so that they are comfortable, safe, and happy there. So if you are looking specifically for a facility um, that cares only for HD patients, there are quite a few of them up in the Northeast. By quite a few, let me back off on that. Let me say it's it's probably a dozen max. Um, but there's really good places, and I have a list of that.
Mhm.
Maybe there's a way that we can attach that, or if you'd
Yeah.
like to contact me, um, we can throw up my email and I can help out with that. You can also find me on the HDSA website if you're looking for resources.
Yeah,
So
that was
there
a tip.
are things that can happen. Um, One thing would be that you would need to establish Medicaid in the other state. It's doable. It's a process, but it's doable. It doesn't happen fast, but there are resources out there.
Yeah. Thank you. I'll answer this one. This question I'm getting a lot. I heard about the AMT 130 announcement. How do I get involved? And when will treatment for HD be available? So I kind of addressed a little bit of this in my talk in the beginning, but this is an early trial, just a public announcement. It actually hasn't even been the results haven't even been published yet. So, unfortunate thing is that they enrolled already their fourth cohort. They are closed for enrollment. So, I mean, you can contact centers like UAB, but they will tell you that they're not enrolling any other patients for this. And so, unfortunately, I have to tell you guys that we got to wait to see if the drug actually gets, expedited approval and gets FDA approved. It's likely, though, that the Unicure, the sponsor of the trial, will be asked to do more studies, more likely, and they have been talking to different various centers. So I would say stay tuned, but for right now, treatment's not available. It's still a research drug. It's not an approved drug, and unfortunately, they're not enrolling. Okay. Um, this will take, I want to sort of shift to Emily. You did a really good job about talking about research, but um, can you remind our folks how it's like for our center, how do you get involved in research, clinical trials here? What do patients need to do um, to get involved in a trial for HD? How do they do it?
So specifically at our site, if you have a visit, that's a great time to talk to either Dr. McFarland, who does most of our HD visits, or whichever provider you are seeing. Our research is really integrated into the clinic, and you can usually find me hanging around, especially on our HD clinic days. Other than that, you could reach out to me personally. My email is emily.reynolds@neurology.ufl.edu. Even if you're not a patient of our clinic, you can still try to enroll in our one study, Enroll HD, by contacting me or Dr. McFarland directly.
Cool. I'm gonna give a shout out for there is a couple of resources online. Like there's a HD trial finder. You can get to that through the HDSA website. Um, if you haven't tried it, I think it's more complicated for patients' caregivers, but clinicaltrials.gov. So the NIH, the government keeps a list of active trials, and most all trials and sponsors are required to register on that site. So you can actually, it's a search engine. You'll need to put in Huntington's disease and look at all the trials. There's ways to filter for active trials and recruiting trials, and there's a lot of information on that website about sort of what the criteria for being included or excluded for that particular trial. But I will say it's not the most user friendly. So please ask us questions. We can kind of direct you. But Trial Finder's great. HD Buzz is another website I've seen used by a lot of folks that gives you kind of the up-to-date news about stuff on Huntington's disease. So try that. So let me see. I'm going to grab another one that I have. For me, actually, this patient or family member actually wrote me saying my loved one has Huntington's and has progressive dementia, and they're getting more confused, agitated, very impulsive at night. They're now incontinent. And is this expected for Huntington's? And then lastly, really the question was, what do I do? So unfortunately, Huntington's is quite progressive, and the more advanced stages can be quite difficult. Behavioral issues that relate to dementia can really make caregiving very difficult. And dealing with a confused, agitated, anxious patient who isn't really doesn't have insight or awareness about their disease or what's going on at that stage and can be really trying. I would say, first of all, safety is really important. So if they're being aggressive and you're feeling unsafe, get help. Okay. I realize calling 911 on your loved one sounds like a terrible thing to do, but they're there to help you. It's really not about getting somebody in trouble or getting admitted or Baker acted. Baker acted in Florida is the one mechanism if someone is actually unsafe and maybe trying to harm themselves or other people. It may be temporary. You should know that if it's for a real health reason, it doesn't necessarily mean they'll be admitted to psychiatry. If it's a medical reason, then they'll still be admitted to a hospital to be treated. We treat the medical condition first, okay? But sometimes it does require treating the mood or the psychiatric condition, okay? And again, safety first, number one, and then reaching out to us, your caregivers, to help out. Um, so there can be things like infections that can cause a person to go over the edge. And there can be sort of dehydration if they're not eating. There are many medical reasons that can cause sort of what we call an acute change. And that's something we'd be asking you about. Um, Most of the times, though, this is just progression of disease. And so we need to sometimes talk about the next stage of treatment. So medications may be helpful, and there are mood medications that we can turn to help with, some of which are sedating. And so kind of have to balance. So I personally like to talk about balance of treatment. Every medication carries side effects, and balancing one that is needed and the risks versus benefits of a treatment like that. So, and with everybody, with any discussion that we have, it's also important for not just myself, but other physicians to think about behavioral things. Okay. So instead of just running to a drug, thinking about what is causing the agitation. Are they not sleeping are they sleeping a lot during the day, not sleeping at night? Are they unable to communicate that they're uncomfortable? Are they in pain? Is the temperature wrong? Are they constipated? Severe constipation and they can't communicate that can lead to real agitation. So asking the right questions and sometimes just behavioral things like changing the situation, um, redirection, sort of changing. So a lot of patients with dementia, their mind wanders, so they think of one subject, but they can get off track. So just redirecting them to another subject can sometimes help calm them down. Sometimes it's just enough to put them in a safe place and walk away. So be thinking about your children, and the same thing for adults. You need to make sure they're safe, okay? But sometimes giving them a time to cool down is all you need to get them to calm down, okay? So behavioral modifications can be important, but there does come a point where treatment is necessary, and that's where coming to us. And we do have some treatments, but it's just a matter of balancing them. This is sort of expected in the progression of HD. Dementia is part of the disease, unfortunately. Not all patients develop agitation, okay? It's actually a relatively small part of that, patients that we see. So it is expected to see this progression. So just reach out to us. Unfortunately, with dementia, control of bowel, bladder, things is part of disease, and it can be a difficult and trying thing to manage. Again, ask us. There are some things we can manage, but sometimes briefs, diapers, for women, there's Kerwickavir, things like that could help with urination and incontinence. We can talk about even having potties or like a porta potty or a commode near the bed that sometimes if it's too difficult to get from bed, and it's just a matter of urgency. So there are some things that we can help out with. And we work together as a team to help you. So difficult question, but there are answers for that. Let's see. We're running out of time. Maybe I'll ask one question for Alana, since I know you're sort of expert on this a little bit, but can you tell me what are advanced directives and why do I need them? Or why do our patients need them?
Okay, so yes, I believe that every person needs advanced directives in place, um, regardless of whether you have Huntington's disease or not, because you probably have very clear ideas about what kind of medical things you do and do not want done. But if you have not discussed these with your family or your friends, or if you, sorry, I lost my train of thought there. They are not going to know if you don't have that written out, or let's say that you have family members who live further away and they may not see mom or dad on a regular basis because they're in another state. They may not agree with what mom and dad have talked about. So you want to have that in writing. You want to have conversations with your family, I would say most important of all, but to have it in writing and have that on your medical record. So that's the first one. That's technically called a living will. The second main one that I recommend to people is having a healthcare surrogate. There's other forms that are similar to that, depending on if you get them done with an attorney or if you want to do something that's more detailed, like a PULSE, which is a physician's ordered life-saving treatments, if I'm remembering that correctly. So those will give step by step what kind of things, who is going to make your medical decisions for you if you're not able to talk for yourself. So usually you pick one person. For most of us, if we're in a relationship, that would be our partner. Or it could be that you have someone medical in the family who you feel could help navigate that with some of the providers that you might be dealing with at end of life. Let's see, where else was I thinking of? Oh, sometimes it happens that the first person that you have chosen to be your main decision maker, they may not be available for some reason. Sometimes things unfortunately happen to couples where the person that they had said would make their decisions, they're also hurt. Perhaps some kind of a car accident. So who is going to be your backup person who's going to do that for you? That could be one of your children. It could be your sister who's a nurse practitioner. You might have a doctor in the family. So having them to back you up. And the important thing about who you choose to make those decisions is you have to be confident that that person is going to honor your wishes, even if they may not agree with them. Like some people say that they would not want to be on life support for a long time. Some people believe that that they don't think it's right to do that. But the person who's making those decisions for you, they need to go ahead and be willing to say yes to the doctors about what they want done. I hope that was clear enough.
I think that's really clear. I will just say as a physician, um, feel free as a patient caregivers to ask us questions. Let's say sort of a uncomfortable conversation, but we're open. I'm happy to talk with patients about it. There are a lot of things that surround advanced directives, thinking about a DNR, what the heck is that? Those kinds of questions. And I will also say that these documents are not immutable, not set in stone. Sometimes things do change and you have to update them. And even at the time, if you're, aware or able to change, you can change. So, having a DNR doesn't necessarily mean do not treat, but it is something that you need to think about and ask your caregiver about, and your provider some tough questions, if you will. But it's worth that short conversation, and update it from time to time with family members, loved ones. So that's good. That's really helpful. I'll do the last question. Do you want to take it, Kayla? I will send you one that this is
Sure.
just one that, my mom just has HD. And this is from a woman who says, I recently got engaged. I want to get tested. How do I go about it? What's it going to cost me? What about my employer? I mean, what if I want to get do this anonymously? Do I have to? Um, can you just answer that?
Yeah, of
Yeah.
course.
Yeah.
Um, so it's always a choice to get tested, and that's why genetic counseling is part of this process. In terms of cost, usually if it's for predictive testing, it's less likely to be covered by insurance, but it can usually be max $200, $250 for testing. It depends on someone's insurance, and the genetic counselor you speak with or myself would tell you that personalized to you. And then in some clinics, this can be done anonymously. In our clinic, this is not something that we practice or offer to patients. But in terms of employment and protections in that manner, I touched on some genetic discrimination laws and how those protect people, and employment is part of that. That's part of the federal law, GINA, which protects employers from knowing about this information or asking about it, as long as, again, the employer is more than 15 employees and it's not part of the US government or military. But if an employer asks, do you have this? You don't have to provide that genetic test result for them. And it also applies to children of people as well who have positive genetic testing. It's not something that they ever have to provide. If an employer overhears you mentioning this, that is not protected by this law. So it's only when they specifically ask and ask for those records. And I think I answered all parts of that question.
You did. You
Okay.
did.
Okay.
I think we should both sort of say the same thing. I think we encourage you to come to a center to do testing.
Yeah.
You can get a test done by your local doc or a neurologist, but if they don't have knowledge about HD, I think we feel a little strongly that they may not be able to provide the needed pre and post-test counseling. That could be really important. So you can talk to that if you want, Kayla, too.
Yeah. Yeah, I think that's very important. I mentioned the different visits that we have as part of the Center of Excellence. It follows the protocol, and not every office is going to do that. If you're not a Center of Excellence, they might not be aware of that or practice that as strongly. But it's helpful for people to really think on the front end before testing and weigh all the different impacts, decisions personalized to them. Some people come in and say they want to do testing, and after we talk with them, they decide they don't want to do testing. So that's the whole purpose of going to a center of excellence and having these conversations. I second that as well.
All right, you get the last word. Okay. Listen, I've got to wrap this up for everybody. It's been a wonderful morning, and we're already in the afternoon. So everything's going to be recorded or has been recorded today, and we'll put it on our site. But I want to thank everybody who participated in today's sort of HD Education Day, especially our patients and caregivers who gave of their time too. But and again, I'm going to shout out to Amanda and Emily for helping organize this today. So thanks for your time. So have a good day. Reach out to us with questions or emails. Got a website, but reach out to us if you have any other further questions, and we're happy to see you. Take care.